Hi, this is Dr. Jamil Beshear here to give an introduction to regenerative medicine. So, regenerative medicine is an exciting new field that uses the body's own healing powers to create healing in tissue injuries. I specialize in orthopedic procedures, spine problems, joint problems, ligament problems, tendon problems, muscle problems, connective tissue problems. I do two types of treatments. I do one called PRP, platelet-rich plasma. Within the platelet-rich plasma treatment, there's another form of that called platelet lysate material, and I'll explain the difference between the two. But that's one procedure, PRP and platelet lysate material. And the other one is a bone marrow concentrate / stem cell procedure. That's where we take bone marrow from a patient's hip, the back of their hip, and we process it in a lab to isolate out the progenitor, the healing cells from the bone marrow, and concentrate those. These are the cells that are responsible for healing in the body normally, and we're able to get hundreds of millions of these in the lab from a bone marrow aspiration, which then helps tissue to heal. Now, we do use the PRP sometimes in conjunction with the stem cells. They act as signals to the cells to create more healing. The PRP and PLM procedure is its own procedure, but like I was saying, the bone marrow concentrate / stem cell procedure, we do use PRP within that procedure. Now, why do we choose one versus the other? A lot of it has to do with the level of injury. So if someone's knee has a mild injury, it would be a PRP candidate. If it was a more severe injury, like a meniscus tear or an ACL tear or an MCL tear or moderate to severe arthritis, we would do stem cells. For like mild arthritis, a small ligament strain, not really a tear, then we would use PRP. Now, platelet lysate material, like I was saying, is part of the PRP family. That's a way of taking platelets, rupturing them, freeing the molecules in solution, and then injecting those into tissues that are injured. Now, the platelet lysate material, where we use that predominantly, is in the spine. You've heard of transforaminal or epidural injections where people get traditional pain, steroid injections to cool down inflammation. So we're able to take the platelets, process them in the lab, rupture them, open them, filter it, so it's very small particles, just messenger signals, so it's safe to inject this into the epidural space. And just like a cortisone injection, then we inject this platelet lysate around the nerves, around the discs, to get the disc bulges to heal and the nerves to begin to heal around those areas of injury. Now, PRP is more used for joints. So if someone has a problem with their spine and it requires multiple types of treatment, like the platelet lysate material for a disc herniation or nerve compression injury, the facet joints might have arthropathy or some arthritis, we would put PRP into those facet joints. Bone marrow concentrate, like I was saying before, works very good for tears. Rotator cuff tears are probably the number one success story when it comes to bone marrow concentrate / stem cells. Meniscus tears in the knee do very well. Labrum injuries in the shoulder do very well. Mild to moderate arthritis does very well. There are limitations. When you get to severe arthritis, when there's really a breakdown in the joints and that normal, healthy chemical composition of the joint begins to die, what I do does not work. So severe osteoarthritis in the knee, where you see cystic changes in the bone, completely eroded cartilage, those patients are still candidates more for like a knee replacement. Same with the shoulder. They'd be candidates for like a shoulder replacement. But the moderate and mild cases of arthritis do well with regenerative medicine. This is a spine model. I'm going to kind of explain what's happening here. So this is the disc between the vertebra. Here's the spinal cord. Here are the nerves that are exiting out of the neuroforamina. So when we do the platelet lysate material, we take a needle and we go down just like we're doing an epidural transforaminal injections, and we inject that platelet lysate material so it bathes the backside of the disc and around the spinal cord and the nerves that are exiting. That creates a lot of tissue healing. Everything is done under direct visualization. We use two types of visualization. We use what's called a C-arm fluoroscopic X-ray live imaging and ultrasound. Ultrasound allows us to visualize soft tissues such as muscles and ligaments and tendons. The X-ray allows us to really make sure we're getting into the joints. We inject contrast under X-ray. It shows good flow into the joint capsule, whether we're injecting a facet joint in the back, a shoulder joint, or a knee joint. We can outline those structures with the contrast agent and get healing after we inject the bone marrow concentrate / stem cells or the PRP. ACL tears are also done under fluoroscopic guidance. We're able to take a needle, direct it directly into the ACL tear, inject contrast, which goes up the sheath of the ACL, showing the outline of the ACL, followed by injection of bone marrow concentrate and PRP into the sheath of the ACL to generate healing. PCL injuries are done the same way. Rotator cuff injuries, we tend to do under ultrasound. We can visualize, again, soft tissues, see these tendon tears, inject bone marrow concentrate and PRP into these injuries.
Thank you so much, everyone, for joining us. This is Dr. Jamil Beshear.
Thank you.